Good afternoon. Thank you for joining us. We will get started right at noon. Good afternoon. Thank you so much for joining our webinar. My name is Micah Whitfield, and I work with Healthy Mothers, Healthy Babies. And if you don't know, our goal is to improve maternal and infant health outcomes through advocacy, education, and access to vital resources. So we are very pleased to offer these webinar series, and we always are able to find great speakers to talk about topics that are important to maternal and infant health. This webinar and others like it, if you like it, you can please join our newsletter. You'll see a link there on your screen, as well as look at any of our upcoming events on our website. And before we start, I just want to quickly plug. I want to quickly plug our 2019 Maternal and Infant Health Policy Breakfast. That's going to be on February 7th, right across the street from the Capitol. If you are interested at all, please go to our website, hmhbga.org. We will honor several legislators that have moved important topics on maternal infant health, as well as have a panel discussion with some other legislators around topics that, are important to maternal infant health. So we would love to see you there. It's a great breakfast to attend. And this year it is actually in collaboration with March of Dimes. So our presentation today is on maternal and childhood immunization. So our presenters will be providing an update from CDC. And we started talking about this topic a few months ago and was able to find two great speakers that can really provide the landscape of what's happening with this. We will offer continuing education credits for nursing. So after the webinar, you will receive a link from myself with a survey. Once you complete that survey, you will be eligible for those CE credits. And we will ask you to type any questions that you have during the presentation in under the questions box, and I will read those questions, as many as I can get to, at the end of the webinar. Okay, so our presenters, our first presenter is Candace Robinson. She received her medical degree from Wayne State University School of Medicine, and she completed her residency training in pediatrics at Nationwide Children's Hospital. She completed a general academic pediatrics fellowship at Vanderbilt, during which she obtained her MPH. She's currently a medical officer at the Immunization Services Division within CDC's National Center for Immunization and Respiratory Diseases. In her current position, she serves as the CDC lead for the Child and Adolescent Immunization Schedule Work Group of the Advisory Committee on Immunization Practices and provides immunization education to providers. Our second presenter, Ashley Brooks. Ashley Brooks is the health communication specialist serving as lead for the adult maternal immunization communication campaigns at CDC. in the National Center for Immunization and Respiratory Diseases. She previously worked on seasonal influenza communications. Prior to her time at CDC, Ashley has experience with diabetes management programs and breastfeeding health. She has a master's in public health from the University of Tennessee at Knoxville. So with that, I'm going to turn it over to Candace, our first presenter. And Candace, you should be able to control your mouse now. Let's see.
Yes, it looks like it's working. Thank you so much for the introduction, Micah, and thank you all for joining us today. We're happy to be talking about immunization with so many people working in the maternal and child field here in Georgia, right in our own backyard. Let's start. There we go. With disclosures, first, we have no conflicts of interest to disclose. Discussions on any off-label uses of vaccine products are in the context of the recommendations made by the Advisory Committee on Immunization Practices, or ACIP. Use of any trade names in this presentation is for identification purposes only and does not imply endorsement. And the opinions expressed in this presentation are solely those of the presenters and do not necessarily represent official positions of CDC. Here are some items that Ashley and I will be discussing today. First, we're going to talk about maternal and childhood immunization recommendations, some immunization coverage rate information, and some challenges. Next, we'll discuss some CDC research with pregnant women and parents, tips for communicating with pregnant women and parents, and finally, we'll end with some CDC immunization resources. So, let's start by talking about why maternal immunization is so important, especially when it comes to influenza and pertussis vaccine. Influenza during pregnancy can be dangerous for many reasons. Influenza illness during pregnancy has a higher risk for severe illness and complications, and there is some data to suggest increase in delivery complications such as fetal distress, preterm labor, or cesarean section in mothers who have flu during pregnancy. Protective levels of anti-flu antibody for mom results in passive antibody transfer for baby, and you get reduced risk of influenza infection and hospitalization among infants who are under 6 months of age. And this is important because infants under 6 months of age, newborns, are too young to receive flu vaccines. There are no flu vaccines that are approved for use in infants less than 6 months of age. Pertussis, or whooping cough, is a serious vaccine-preventable disease that has made a comeback in recent years. Newborns can catch it from their parents, siblings, or others that they come in close contact with. In recent years, pertussis illness, up to 1,000 infants have been hospitalized and up to 15 have died each year in the United States due to pertussis. Most deaths are among infants who are too young to be protected by the childhood pertussis vaccine series, which is included in the DTaP vaccine, that starts when infants are 2 months old. Infants are at greatest risk for contracting pertussis and having severe and potentially life-threatening complications from the infection in those first few months of life. Maternal Tdap vaccination helps to protect newborns, and we'll talk about that a little bit more later in a later slide. Fewer babies will be hospitalized for and die from pertussis when Tdap is given during pregnancy rather than during the postpartum period. And cocooning alone may not be effective and is hard to implement. And cocooning refers to vaccinating anyone who comes in close contact with an infant. Here is a summary of CDC's maternal immunization recommendations. This fact sheet was developed in collaboration with the American College of Obstetricians and Gynecologists. Now, this sheet clearly shows which vaccines are indicated during every pregnancy, flu and Tdap. Those are the first two lines on the table there. The vaccines that may be given during pregnancy in certain populations. And it also outlines the vaccines that are contraindicated during pregnancy. And finally, vaccines that can be initiated postpartum when breastfeeding or both. We are in the process of getting this new fact sheet up on the website, but you will be able to find it at this URL listed here on the slide very soon. Here are the specific recommendations for vaccinating pregnant women with flu and Tdap. Pregnant women should receive flu vaccine during every pregnancy during the flu season. It can be administered at any time during pregnancy, before and during flu season. Women who are or will be pregnant during influenza season should receive inactivated influenza vaccine. And healthcare professionals should administer a dose of Tdap during each pregnancy, irrespective of the patient's prior history of receiving Tdap. Now, the optimal timing for this dose of Tdap is between 27 and 36 weeks gestation, and preferably earlier during that time period. And this is to maximize the maternal antibody response, so the amount of time that the mom has to produce antibodies to that vaccine and pass those antibodies over to the infant via the placenta. So this is the optimal timing for that dose for those reasons. Now let's switch gears and talk about the vaccines those newborn babies will need as they continue to grow. This is a screenshot of CDC's parent-friendly childhood immunization schedule. It shows all of the vaccines recommended from birth through 6 years of age. And we will be redesigning this in 2019, but it will still deliver a simplified view of the schedule for easy consumption by parents. The CDC recommended schedule protects children from 14 vaccine preventable diseases, which are listed here. The schedule is designed this way to provide protection early in life before children are exposed to potentially life-threatening diseases. The CDC schedule is officially endorsed by the American Academy of Pediatrics, the American Academy of Family Physicians, and the American Academy of Obstetricians and Gynecologists. Over the years, CDC's research has revealed that many parents aren't aware of some diseases that can be prevented by vaccines, like Haemophilus influenza type B or Hib, or pneumococcal disease. Or they may be aware of diseases but don't appreciate how serious they are, for example, chickenpox or influenza or flu. So how are we doing with immunization coverage for maternal and childhood vaccines? Let's look at the data. Many pregnant women in this country are not getting the vaccines they need. During the 2017-18 influenza season, 49.1% of pregnant women received influenza vaccination before or during pregnancy. 54.4% of women with live birth received Tdap during pregnancy, and 32.8% received both recommended vaccines. Vaccination coverage, regardless of vaccine type, was highest among pregnant women with a provider offer of vaccination, meaning that if they had a provider who offered vaccination, they had a higher rate of being vaccinated. Now, reasons for non-vaccination include concerns about effectiveness of flu vaccine, lack of knowledge about need for Tdap during every pregnancy, and concerns about safety risks to baby. Rates have remained stagnant for years, but we have heard for years that women don't know about the need for Tdap during pregnancy, indicating a need for stronger recommendations by healthcare professionals. As we can see from this graph, maternal flu vaccination rates have remained stagnant over the past 6 years, hovering at around 50%. From 2014 to 2017, CDC conducted internet panel surveys with pregnant women to determine how many had received maternal vaccines. The red bars show the percentage of women who received Tdap during pregnancy, the blue bars before pregnancy, the gray bars after pregnancy, and the green bars reflect women who never received Tdap. The percentage of women who have received Tdap vaccine during pregnancy has steadily increased since 2014, but it remains at about 50%. As we saw on the previous slide, only about half of pregnant women receive flu vaccines. So this means that half of pregnant women and their newborns are potentially unprotected from both pertussis and influenza. CDC tracks childhood immunization coverage every year through the National Immunization Survey, or NIS. Childhood immunization rates remain stable and high. In 2017, coverage was over 90% for vaccination with 3 doses of polio virus vaccine, 1 dose of MMR vaccine or measles, mumps, rubella, 3 doses of hepatitis B, and at least 1 dose of varicella vaccine. 70.4% of children were up to date for the combined 7-dose series. We still face some challenges, however. Vaccination rates are lower in more rural areas and among uninsured or Medicaid-insured children. These disparities are larger for vaccines that require a booster dose in the second year of life, such as DTaP, Hib, and pneumococcal. CDC is working to identify reasons for these disparities and evidence-based interventions. A small but increasing proportion of children received no vaccines. That rate was about 1.3% of children in 2017 compared to about 0.8% of children in 2016. Unvaccinated children in the 2017 NIS survey were disproportionately uninsured. This graph shows how childhood immunization rates have remained stable since 2011, although we do see some variation in coverage by vaccine, with MMR coverage being the highest and 2 doses of hepatitis A vaccine being the lowest there in that chart. So the MMR vaccine is that blue line at the top, and then with polio vaccine being the highest. Polio is the blue line at the top. MMR vaccine is there right after it, and then 2 doses of hepatitis A is at the bottom. This slide shows the number of measles cases that have been reported in recent years. The large number of cases in 2014 was due to an outbreak associated with the California theme park, which started in December of 2014 and continued into early 2015. Measles is still common in many parts of the world and can be easily imported to the United States. For example, we have recently seen measles outbreaks among Orthodox Jewish communities in New York and New Jersey caused by cases imported from Israel. So far in 2018, there have been 292 reported cases in 26 states and the District of Columbia. Finally, let's look at pertussis. Pertussis is endemic in the United States, with peaks in reported disease every few years and frequent outbreaks. Although many pertussis cases are not diagnosed and therefore not reported, this slide gives us an idea of the number of cases we see each year. Pertussis cases have steadily increased in recent decades, with more than 20,000 reported cases in recent years. In 2017, there were 18,975 cases, including over 2,200 cases and 9 deaths in infants under 1 year of age. We do not yet have the final numbers for 2018, but stay tuned for those. While these numbers may seem high, we no longer see 200,000 cases per year like we did before we had pertussis vaccines. So we have had there is improvement from the time period before pertussis vaccine. Okay, so now I will turn things over to Ashley Brooks, who will tell you what we have learned about vaccine communications through our audience research. She will also talk about tips for communicating with pregnant women and parents, as well as CDC educational resources. So, Ashley, over to you.
Thank you. I just want to make sure everyone can hear me.
Yes.
All right. Okay. Clicking the mouse. Okay, there we go. So first, we must understand the knowledge, attitudes, and beliefs when it comes to vaccination. CDC conducts both formative and evaluation research with pregnant women, parents, and healthcare providers to inform its immunization, education, and research and outreach. So to do this, CDC uses several methodologies, including but not limited to focus groups, in-depth interviews, online surveys, and polls. This research helps CDC better understand the audience's knowledge of the diseases and the vaccines, and it also helps CDC to track attitudes, beliefs, and self-reported practices over time. So in 2014, CDC conducted mixed methods research with pregnant women on the topic of maternal vaccines. The research included surveys, focus groups, and in-depth interviews. And then here on this slide are some of the key findings. So there was low awareness about pertussis, flu, and vaccines. 69% of pregnant women reported receiving a flu vaccine recommendation, and 41% reported receiving a Tdap vaccine recommendation. So we found that protection for their babies is very important. Pregnant women are high information seekers, but are not actively seeking information about maternal vaccines. They want to receive vaccine information from their healthcare providers, and they do have questions about the recommended maternal vaccines. We know pregnant women have several questions once they realize they do need vaccines and they may not have all of the information. Some of the questions most often heard include, is the vaccination safe for me and my baby? Why is vaccination needed every pregnancy? Why hasn't my doctor talked to me about this? And the list goes on. CDC did a longitudinal panel study with 200 women from second trimester of pregnancy to the child's 19th month of life, starting in 2014. The objective was to learn about their knowledge, attitudes, and plans related to vaccines for their babies. As we see here, the initial survey showed that 85% of women had already made a plan for vaccinating their baby by their second trimester. This is what they had decided. 75% were planning to receive all vaccines recommended by their child's doctor or nurse. 10.5% were planning to delay or space out some vaccines. 4% planned to receive some but not all vaccines, and 10.5% had not yet made plans for vaccinating their baby. So a key takeaway from this is that women are making plans for their babies' vaccines very early, even before their babies are born. And it's important for them to consult credible sources of information to get their questions answered. For example, prenatal providers can encourage pregnant women to meet with a pediatrician before the baby is born. So every 2 years, CDC conducts a national online poll of parents of children ages 7 and younger. Approximately 2,500 parents participated in the most recent poll, which was fielded in August through September of 2018. Some of the key findings include that 92% think that vaccine-preventable diseases are somewhat or very serious. 90% believe vaccines are somewhat or very important for keeping their children healthy. 8% report not vaccinating according to the recommended schedule. And then lastly, 62% somewhat or strongly agree that it's okay for parents to delay vaccines as long as they stay within the CDC schedule. So while most parents think that the vaccine-preventable diseases are serious, a small but important percentage classify themselves as vaccine hesitant and plan to delay at least one vaccine in the future. The 2018 national poll also confirmed the importance of healthcare providers as a trusted source of vaccine information. So not only pediatricians, but also prenatal care providers. The 3 most trusted sources of vaccine information were baby's doctor, family, and prenatal care providers. 74% reported that their child's doctor was their most trusted source of vaccine information. It's also worth mentioning that a quarter of parents cite the internet as one of their most trusted sources of vaccine information. So even if parents vaccinate on time, we know that majority of them have questions or concerns about vaccines. So this slide shows some of the most common questions. The top most 5 common questions are regarding long-term side effects, short-term side effects, vaccine ingredient safety, whether combination vaccines are safe, and then also what ingredients are included in vaccines. So in summary, most women make decisions regarding childhood vaccination while they are pregnant. Most parents vaccinate or intend to vaccinate according to the CDC recommended schedule. Parents' attitudes about childhood vaccines have remained consistently positive on a national level. Parents do have questions about vaccines, but their questions do not necessarily equal their concerns. They just have questions regardless of their immunization plans. And healthcare professionals remain parents' number one trusted source of vaccine and health information. So now let's transition to some tips for communicating with pregnant women and parents. So let's talk a little bit more about making a strong vaccine recommendation, as I mentioned in my talk. Our research indicates that some pregnant women do not feel their providers are strongly recommending vaccines. Providers should state clearly that they would like her to get vaccinated. An example of this recommendation is on this slide. Today, you need 2 vaccines to help protect you and your baby against flu and whooping cough. Healthcare providers can share information with pregnant patients. These tips are great for general vaccine recommendations with adults, but also in case of pregnant women. So share, each of the letters stand for something. So share is share tailored reasons why the recommended vaccine is right for the patient. H, highlight positive experiences. These experiences can be both personal or in practice. A, address patient questions and concerns. An example is the most common side effects are mild, like redness, swelling, or pain in your arm where the shot was given. That should go away in a few days. The R stands for remind patients about the protection vaccines can provide. And finally, E is explain the potential cost of getting the disease. These costs include serious health effects with each disease for mom and baby, time lost, like missing work or family obligations, and of course, the financial cost associated. So let's talk about how to improve communication with parents during vaccine visits. CDC recommends using a 3-step process. First, use a presumptive approach by simply stating the vaccines that the child will receive, as opposed to asking parents what they want to do about vaccines. So this assumes that the parents will accept vaccines because national data shows that most parents do. It is important to note the presumptive approach does not mean pushing or pressuring parents to vaccinate, both can which erode the trust that a parent places in a healthcare provider. But if parents seem hesitant to vaccinate, give your strong recommendation. Explain why you personally believe that vaccines are important. And finally, listen and respond to parents' questions. Remember that questions do not always equal concerns. Many parents have questions about vaccines even if they do intend to vaccinate. The presumptive approach does not exclude questions. On the contrary, by soliciting questions, you can strengthen your relationship with parents. So assess the level of information you think a parent is seeking when you respond. Some parents, only need basic information while others want more detail. And also, you can view common parent questions along with CDC suggestions on how to respond on the web link here that's on this slide. So here are some additional tips for having vaccine conversations with parents. Acknowledge both the benefits and risk of vaccinations. Use a mix of science and personal anecdotes. And, that right mix will depend on the parent, kind of how we mentioned on the previous slide. You can reduce the stress of shots by teaching parents how to hold, comfort, and distract their children during the event. Respect a parent's desire to work in a partnership with you. Keep the conversation going even if a parent chooses not to vaccinate that day. Document questions for future conversations, and if a parent expresses worry or doubt, follow up with them via phone call or email. So now I would like to go over a few free CDC resources for clinicians, pregnant women, and parents. CDC offers a wide range of free trainings for clinicians, most of which offer CE and CME credit. So some of these include the You Call the Shots online modules, about vaccine preventable diseases and vaccine recommendations. Live net conferences about current issues in immunization. A series of online webinars about the content of the Pink Book, which discusses the epidemiology and prevention of vaccine preventable diseases, and also a webcast on a host of other topics. You can visit the website in the blue box at the bottom of this slide for more information. CDC has also worked with Medscape, and we continue to work with Medscape to provide expert commentaries from CDC subject matter experts on vaccination. So here you can see two commentaries by our National Center Director, Dr. Nancy Massonier, and also our previous Director, Dr. Ann Shuggett, about vaccination and talking to parents. We also have a series of short videos called How I Recommend. These videos feature various clinicians demonstrating how they recommend vaccines. So this is a new series for us, but we've been seeing great pickup. These two videos on this slide focus on recommending a flu vaccine to pregnant women. So one features a certified nurse midwife, Carol Hayes, and the other features a family physician, Dr. Pamela Rockwell. We have several other videos coming out kind of across our audiences. So in the near future, we will also be launching a similar video featuring a pediatrician talking about how she recommends childhood vaccines. And these videos are also available across the lifespan, so from birth all the way up through adulthood. So we also have an online toolkit for prenatal providers. So this toolkit kind of serves as a one-stop shop for all of your vaccine recommendations, schedules, educational materials for both providers and for patients. So we are very proud of this toolkit, and I encourage you to take some time to look through the various resources that are available on this website. And again, you can find the URL in the blue box at the bottom of this slide. So we have several digital resources available targeting pregnant women. So our website frames maternal vaccines as part of a healthy pregnancy. These web pages cover vaccines that pregnant women need before, during, and after pregnancy. We also have web pages geared towards the provider audience about making recommendations to pregnant women. Additionally, our web pages are also home to several resources, including a maternal vaccine quiz that tests knowledge about vaccines during pregnancy, an animated video that highlights how to have a healthy pregnancy, along with taking care of herself, working with her doctor, getting her home ready, and pregnant women should get vaccinated against flu and whooping cough, of course. A top 7 list CDC developed titled "Vaccines and Pregnancy: The Top 7 Things You Need to Know," which explains information pregnant women should know about vaccines and how they contribute to protecting both mom and baby. All of these resources can be found at cdc.gov/vaccines/pregnancy. We offer several print resources, including fact sheets and posters. These posters are for pregnant women, but we have different fact sheets for providers and pregnant women. The fact sheets for pregnant women are also available in Spanish. Patient education materials they include posters and videos for your waiting rooms. They're low literacy. They're for diverse audiences and language needs. They provide answers to commonly asked patient questions and include tips on providing a strong recommendation, especially when making vaccine referrals. We found that moms are responsive to messaging about the importance of vaccines for protecting their baby. Now, I'd like to switch gears a little bit and tell you about some resources related to childhood vaccines. So many health professionals talk with parents on a daily basis about protecting their children from vaccine preventable diseases. CDC, AAP, and AAFP created a suite of online materials to help assess parents' needs, identify the role they want to play in making decisions for their child's health, and then communicate in ways that meet their needs. These resources are collectively called the Provider Resources for Vaccine Conversations with Parents. So these resources include guidance for how to talk with parents about vaccines, including how to answer some of those common questions, plain language fact sheets about vaccine preventable diseases, available in both English and Spanish, fact sheets about vaccine safety, information for parents who choose not to vaccinate, and more. So all staff in pediatric practices, including non-clinical staff, play an important role in supporting parents in their vaccine decisions. This slide deck that's on this screen presents concrete ways that your practice can create a culture of immunization during all steps of a well-child visit, from check-in to check-out. It is intended for use by physicians or vaccine coordinators during staff meetings or lunch and learn presentations. You may customize it with your own slide template, logo, and practice-specific information. And it can be found at the URL on this slide. So this slide shows CDC immunization resources that you can share with parents. These include fact sheets, the easy-to-read immunization schedules in both English and Spanish, and infographic and listicles. Once again, the URL listed on the bottom of this slide shows more resources like this, and including posters and videos. So this is another great resource, our frequently asked questions about infant vaccines. A few examples include, are vaccines safe? Can vaccines overload my baby's immune system? What's wrong with delaying my baby's vaccines if I am planning to get them all eventually? So these fact sheets are written for parents of children 0 to 2 years of age, and CDC developed these in collaboration with both AAP and AAFP. Once again, they're available in both English and Spanish. They can be viewed online or downloaded as a PDF to print and copy for parents. So with all of that, as we wrap up this presentation, I just want to go over a few key takeaways related to maternal immunization. So maternal immunization, of course, protects both pregnant women and their babies. Pregnant women should get a flu shot and Tdap during every pregnancy. Vaccination coverage rates remain stagnant at around 50%. Healthcare professional recommendations have a big impact on the vaccine decision, and it's important to focus on effective messaging and communication strategies. Oh, the slide's not changing. Sorry, everyone, the slide's not changing. There we go. Okay, sorry about that. And so here are a few more things that I want to talk about related to childhood immunization. The recommended immunization schedule protects children from 14 serious preventable diseases. However, we still see outbreaks of childhood diseases like measles and pertussis. Women make decisions about their baby's vaccines early, often while pregnant. Many parents have questions even if they choose to vaccinate. And prenatal care providers can point parents to credible information and also encourage them to meet with a pediatrician while pregnant. And last, CDC offers tips to healthcare professionals and helps to have better vaccine conversations. So thank you for your time, and I think we'll now take some questions. Micah?
Sorry, I was still on mute. Sorry about that. So I have two questions already, and if you all are want to go ahead and type your questions in the box, please feel free, and I'll read them as I can get to them. The first one was, for passive protection for influenza, what is the latest time prior to delivery that a mother can get the vaccine and still transfer this passive benefit to baby? Also, when is ideal time in pregnancy to get the vaccine?
So, this is Candace. So, while for pertussis, we have specific outlined an ideal time to give the vaccine during pregnancy for maximal transfer. They have not outlined a similar ideal time during for vaccination with influenza, and for a couple of reasons. One, as with pertussis, influenza vaccination, no matter when given in pregnancy, even if the day before mom delivers, for example, at an extreme, you're providing benefit to mom who is at risk for serious disease, serious influenza, should she contract influenza while pregnant or even possibly immediately postpartum. So they don't have an ideal time outlined for flu vaccination the way we do for pertussis vaccination. I also want to note that even for pertussis vaccination, if, for instance, the woman does not get in within that ideal window, it doesn't mean that she can't be vaccinated. She could still be vaccinated after that window, but if that patient comes to you during that window, you want to vaccinate as early as possible in that 27 to 36-week window. For pertussis vaccine. And a good marker for that, we often say if you do take care of pregnant women, a good time to give it is when they do their glucose test somewhere around the 28th week of pregnancy. That's a good time to line it up. But to answer the original question, they don't have a specific outlined ideal time for flu vaccine the way we have it for pertussis vaccine.
Thank you. The next question is, will the slides be sent out to all of us, or at least the links for printables for families? And so Dr. Robertson, and actually I'll be able to PDF these and send these out to folks.
Yeah, that's totally fine with me.
Okay. So yes, I will certainly send that out along with the survey. I had quite a few people ask about a copy of the slides. So as we're waiting for additional questions, one I guess comment that I had was I was shocked to see some of the higher stats for the influenza and Tdap vaccines in pregnant women, because I know in Georgia our numbers are much lower. We actually do for our prenatal education program a follow-up at 3 and 6 months, and we talk about it in our presentation, and then we also follow up to see if the women were able to get those vaccines. And that's one thing we definitely struggle with is making sure our moms are getting those flu and Tdap vaccines. And then, like, I love the bullet you had that when the provider says to do it, or has it in office, that it increases the likelihood of them receiving it. And that's what we find too. So yeah, I was encouraged though to see that some the other stats were higher than we are in Georgia.
Yeah, absolutely, and that's another good highlight to a main point is that provider patients really respond to provider recommendation for vaccines. So if you are recommending and offering it in your clinic, patients are more likely to be vaccinated when it's recommended by their provider. Just highlight that important point once again.
Yeah.
Agreed, and just to go on the tail end of that as well, and if you do not have the vaccine available in your practice, we've often found that when providers do make that strong referral to another clinic or a grocery store or wherever the vaccine may be available, when they speak to that patient again at the next visit, keep following up with that patient to make sure and have some documentation that patient has taken that vaccine. A lot of times we found in some of our research that providers are not actually doing that follow-up or documentation piece. And so there's no way to know that woman actually get vaccinated. So that's a really important piece as well, is just to make sure you do follow up.
Yeah, agreed. Okay, another question. Let's see here. What are some of the reasons you encounter from patients as to why they do not wish to have the vaccine provided if it's available in the same location?
Yeah, well, we highlighted some of the reasons that pregnant women, I guess I'll talk about the pregnant women piece, that some of the reasons that they don't receive the vaccine. Of course, sometimes they either, if they do have it, hopefully the provider has educated them on the need for it. A lot of times, pregnant women don't recognize or aren't aware of what vaccines are available. Some other reasons include, vaccine, and I think this is with flu vaccine in general, but we highlighted that there's concern about the effectiveness of flu vaccine, lack of knowledge, concerns about safety. And to answer these questions, we have resources available for providers. The website, cdc.gov /, I believe it's pertussis or /pertussis pregnant. Pregnant. Ashley, you can remind me if I'm misrepresenting the address.
Yeah, so it's cdc.gov /pregnancy or vaccines, /pregnancy, and then you can click to the flu vaccine or pertussis or any other vaccines from there.
Thanks. Thank you, Ashley. And that pertussis website, pregnancy and pertussis vaccine website, there are resources, and for the flu vaccine as well, but there are resources to discuss some of the issues or some of the things that pregnant women may be concerned about. So there is actually data on safety of pertussis vaccine during pregnancy on that website that you can access to be able to answer questions about that. There's information on the flu vaccine website about vaccine effectiveness for you to be able to answer questions about that. So just being knowledgeable of some of the concerns and being knowledgeable of some of the ways to respond to those concerns is really helpful. And there's information that will help you be able to answer those questions available on the CDC website.
Great. And then I have one other question. Why Tdap on each PCY? Not sure what the PCY. Maybe I'm reading it wrong.
Maybe pregnancy? Maybe
pregnancy? Maybe
they're asking why Tdap for every pregnancy. So the ACIP recommends Tdap during each pregnancy. And the reason for that is, first, you're providing the Tdap vaccine in order for the infant to get the antibodies from the mom. And what the data showed is that if the mom was vaccinated, with the prior pregnancy, let's say this is pregnancy number 2, the antibodies from that previous pregnancy vaccination, they actually aren't getting enough of those antibodies across the baby. So it's recommended to get one during each pregnancy so that each infant has the same opportunity for protection through maternal antibody transfer across the placenta. And so that's why it's recommended during each pregnancy, because, if mom does have antibody from before, it's not potentially the optimal amount to reach baby, but providing vaccine during pregnancy and during that window maximizes the transfer of antibody from mom to baby. So ACIP recommends it during each pregnancy to provide an equal opportunity for antibody transfer for each infant from the mom.
Great, thank you. Well, that was the last question that I see. Quiet today. But are there any final thoughts that our presenters want to share with our group? And certainly if questions come up, I will forward them on, or you have their email addresses there. You can contact them directly. But is there any final thoughts or anything you all wanted to share?
Well, we just want to thank everyone again for joining us today. And we hope that this information and resources provided here today will be helpful as we all continue to advance the health of mothers and babies. So thank you all very much.
Agreed. And this is actually to follow up. And, there's several great resources out there. And, please feel free to check them out. And CDC is always trying to keep up to make sure we are reaching our consumers and visitors to our site, making sure they're kept up to date with information. So we're always creating new innovative tools to present information. And please check back regularly for updates to information.
Awesome. Well, thank you again. And as I stated earlier, for those that would like the nursing credit for this webinar, once you receive the survey link, you can follow that, and then I will send the uh, certificates out within a week. So thank you again. Thank you again to Dr. Robertson and to Ashley. This is very helpful information, and I will send this presentation out to everyone that was on the call as well. So thank you, ladies.
Thank you.
All right. Have a good one.
Thank you.
Thank you.
Bye-bye.